विभिन्न सत्र रे आसीथिबा जोग देबाकु थिबा हमर वक्ता माने एवं एक कोटिए दिनर कनक्लेव रे जोग देइथिबा समस्तंकु स्वागत करूची सभा को आगे नबाकु अनुरोध करूची।
बहुत बहुत धन्यवाद सर। निश्चित भाव में आर्गस चैनल आम कहीपर जनसाधारण स्वर भाव में निजर परिचय नहीं पारी। तेबे आज कार्यक्रम स्पॉन्सर्स मानक मो अंतरु धन्यवाद देवाक चाहिए। प्रेजेंटिंग स्पॉन्सर एंड आपण माने करताली सहित धन्यवाद ज्ञापन करेंगे। शिक्षा अनुसंधान एसोसिएट स्पॉन्सर्स सनम सैंग्विनस सॉल्यूशंस प्राइवेट लिमिटेड, मणिपाल हॉस्पिटल भुवनेश्वर, अश्विनी ग्रुप ऑफ हॉस्पिटल। बर्तमान आपण समस्त को कहबाक चाहिए आज कार्यक्रम में आम तीनोटी पैनल डिस्कशंस रखीचु। से पैनल डिस्कशन गुड़िक आम फोकस करूँ अग्रणी स्वास्थ्य सेवार परवर्ती लक्ष्य स्थल भाव में किभली भाव में ओडिशा उभा हो पार, संयुक्त सेवा नियुक्ति जीविका निर्वाह एक उत्स एवं रही ग्रामीण स्वास्थ्य संरचना सुस्थ राष्ट्र सुधार। आप समस्ते प्रोग्राम शेष जाए आम सहित बनी रही से अंतर आप समस्त को धन्यवाद करने चाहिए और अनुरोध करने को चाहिए। वर्तमान समय है आम सम्मानित अतिथि मानक से अभिभाषण आमंत्रित करवा। सर्वप्रथम अनुरोध करी गौतम खन्ना सीईओ पीडी हिंदुजा हॉस्पिटल एंड मेडिकल रिसर्च सेंटर मुंबई इंडिया। Mr. Gautam Khanna boasts a 33-year career in leadership roles within the business sector. Presently, he serves as the CEO of PD Hinduja Hospital and Medical Research Center, achieving global recognition in Newsweek World's Best Hospital rankings. Simultaneously, he leads Hinduja College of Nursing and participates in the governing council of KPB Hinduja College of Commerce. His previous tenure of 22 years at 3M, a multinational conglomerate, saw him as the Executive Director and Country Business Leader for 3M Healthcare Business in South Asia. He is actively engaged in numerous Indian industry associations, including QCLAOH, Mumbai, Nat Health, and FIDI. With multiple accolades and affiliations, Mr. Khanna is an alumnus of IIT Kanpur and IIM Kolkata. सर आम अंतरु धन्यवाद देवु आपण भली जड़े प्रतिभाशाली व्यक्तित्व आज मंच में आम सहित अच्छा अनुरोध करी आप रखु।
Good morning, and firstly my apologies, I cannot speak in Odia, so I'll try and I'll speak in English and if you want a little bit Hindi, but English is what I. So firstly, Honorable Minister, Mr. Prithviraj Jayachandan, Hari Chandan, Madam Ashwati, Dr. Sangamitra, Mr. Sahu, Mr. Jena, ladies and gentlemen. Firstly, it's an honor to be invited here from Mumbai to talk about healthcare in Odisha. And I was wondering why am I invited, because I am not a local, I don't know what I can help in Odisha, but you know, some wiser minds thought that I may be able to talk a few things. But I just want to say that from what I've been hearing, I commenced my journey in healthcare around 34 years ago. And when we were looking at the healthcare sector, we used to think, someday it will have a great future. And for many decades, I used to think that future is very bright. But problem was, the future was not happening. But I'm happy to say that now that the present is very bright. And future is, of course, brighter. And what we are seeing is the emergence of a healthcare sector in different parts of the country. And I'm happy to say that whatever I've been reading about Odisha is on the upward path. So there is a lot of good news coming from Odisha now for healthcare also. But just for perspective, for some people who may not know the statistics, how big is the healthcare sector? So healthcare sector in the country is between 3 to 4 lakh crores per year, and which includes hospitals and device manufacturers, etc., which is expected to become 10 lakh crores in 5 to 7 years. That means that if we just keep doing the right thing, we will double and maybe 2.5 times as a country. Now the big thing is the growth of metro versus non-metro. So metros are growing at around 9 to 10%, while the tier 1 cities like Bhubaneswar, etc., are growing at 12 to 14%. And what that means is that there is more growth coming from non-metros than coming from metros. So there is an opportunity here. Why is there an opportunity here? One, of course, we all know that, income levels, and middle class is increasing, and a lot of people in non-metros are now getting wealthier. And you know, the problem of, when we say the problem of there is too much traffic, there is no place in the hotel, there is no flight tickets, all that is an indicator that the economy is doing well and healthcare will do well, because everyone will need healthcare. But just to come back to the healthcare sector, there are three problems in healthcare. One is you need to provide access to healthcare, that somebody should be able to reach a hospital or a health center. Second is affordability. They should be able to afford what is being offered there. And third, that it should be available, that even if you are willing to give a physical infrastructure, where even if it is affordable, there should be somebody like a doctor or a nurse to make the healthcare available to the person. So these are the three main things. Of course, there are much more. Now, physical infrastructure, all of you probably are aware that to set up a hospital is a very, very high capex intensive business. In a metro or in a Bhubaneswar kind of a place, if you want to set up a super specialty hospital, it will be at least 1 crore per bed, plus land. So that means it is not going to be easy to set up a large hospital. Even if you set up a hospital, you need a doctor and you need nurses, and there is a lot of shortage of doctors and nurses. So one of the suggestions which I have offered is that there should be some kind of a program, and I am requesting you, madam and sir, to see, ghar wapsi to Odisha. I don't know if you can use that word, that people who have migrated out of the state and working in US, UK, Bombay, wherever, but they want to come back, let them come back and provide the healthcare here. So doctors and nurses. And of course, nursing education. So there is, talent is important, technology is important, for which investment is important, and infrastructure. The other key thing which we understand is that when we have the talent, many of you here are trying to recruit people. And I can tell you that there are many people who don't have jobs and who have the application for the jobs. But when you start to recruit, you don't find anybody suitable. At least that's my experience. Very few people. That means they are educated, but they don't have the skills to be employable. So when we are talking about talent, nurses, allied health, we need to focus a lot on the skills. So as a state, if we can enhance the skill levels of the allied health professionals and the nurses, that will be a good boost to the sector. There is one thing which I want to add. I'm going to say it openly because people hide it and say it behind my back and everywhere. They say healthcare we don't trust as a patient. As a friend they will, but as a patient they don't. And the reason for that is that everybody wants healthcare cheap. Now the problem is, this is my view, that a human body in USA is the same as India. So why a treatment which is available to a patient in your hometown Germany should not be available in Odisha, should not be available in Calcutta, should not be available in Sambalpur, for example. So that means if you use the same equipment, the cost is going to be there. You cannot make it free. Somebody has to pay for it. So my request is that with the scheme of the insurance scheme which you have done so nicely, that the affordability, the ability to pay has to be enhanced. Because you cannot say that 1.5 Tesla MRI I will not use, I'm going to use a 0.3 Tesla. That is not possible. So you have to buy a 1.5 Tesla, but whatever is the cost, you should have the affordability and to pay. So this leads to the second question, which is the trust and ethics. The success of any healthcare system, whether in a state or in a private setup or in a government setup, depends on the trust of the community with the doctor and the hospital. And many doctors are here, and they will vouch for it, that the trust comes from only two things. Very simple thing I say. Do what you say and say what you do. Don't do anything else. That's all. But problem is, we will say something because we want to attract the patients, but when the patient is inside the hospital, I will give him something else. That is the problem. So I think the transparency and credibility in the private sector, because government I don't think there is a concern, but in private sector, it should be a mandate that you should be transparent and ethical. Just publish what you say. I mean, in a city, you have a Taj hotel and you have a dhaba. So it doesn't matter, but you should still tell what you will do. And one more thing, I saw Dr. Sangamitra here. The reason healthcare systems succeed, key things which is hidden, is the focus on education and focus on research. So if we can invest in research and education, what happens is the clinical outcomes become better. Because of the teaching, our clinicians become better. So the overall system moves up. So that I think should be, I think it's requesting you to push that here. And I just want to say that I know that now I don't know whether it is going to be 1 decade or 2 decades or 5 years, I don't know, when Odisha will really become a super developed state with the adequate healthcare. But I think the journey has started, and I'm happy to contribute in any wisdom or experience which I have. But wishing all of you a great conference and learning from this meeting today. Thank you so much.
Thank you so much, sir. आपने समस्या संको सुनिले सर एम्फसिस देले तीनोटी मुख्य समस्या उपरे जहाँ स्वास्थ्य क्षेत्र रे समस्त उपरे प्रभाव सृष्टि करिछि प्रभावित करूछि एंड किबरि भाबरे विज्ञान कौशल एवं टेक्नोलॉजी निहाती भाबरे आवश्यक ता सहित इन्वेस्टमेंट एजुकेशन रिसर्च इनोवेशन इनेविटेबल विंग ऑफ हेल्थ केयर सर्विसेस आगु जिबा वर्तमान अनुरोध करिबि हम भणरे अछंती हमर गेस्ट फॉनर डॉक्टर संगमित्रा पति निर्देशिका आईसीएमआर आरएमआरसी भुवनेश्वर and ADG ICMR New Delhi would like to take you through her short profile. A physician turned laboratory scientist and public health researcher, Dr. Conclave is currently working as the director ICMR Regional Medical Research Center Bhubaneswar and took over additional charge of additional DG ICMR New Delhi from February 2024. Needless to mention the crucial role played by Dr. Pati, I would definitely emphasize that she was also instrumental in co-developing the first make in Odisha rapid antigen kit for COVID-19 diagnosis. It deserves a thundering round of applause, ma'am. Our distinguished law scholar at Harvard School of Public Health, Boston, with research experience of 25 long years. She has co-authored 300 plus scientific publications in the peer-reviewed journals and co-authored 2 books on healthcare and a few book chapters. She has an index of 45 and I-10 index of 164. Ladies and gentlemen, she has bagged many awards. The recent one I would be definitely naming. This is from Odisha CSR Forum 2024, and the award was Chief Minister's Award for Excellence in Healthcare Services, Government of Odisha 2024. Other than that, Viswamukti Rashtriya Swasthya Seva Samman 2023, Odisha Women Award 2023, Devi Award 2020 times, Power Women Award, Madhubabu Odisha Gaurav Samman Award, and so many awards are there. And of course, She is a Fellow of National Academy of Medical Sciences, India, and Fellow of Royal Society of Public Health, UK, UICC. Ladies and gentlemen, give a thundering round of applause. Let's welcome Dr. Sangamitra Pati. Ma'am.
First of all, thank you for a very generous and magnanimous introduction. Namaskar. Honorable Minister, Law, Works and Excise, Government of Odisha, Sri Prithviraj Harichandanji. Commissioner cum Secretary Health Ashwati Madam, Dr. Gautam Khanna from Hinduja Hospital, also two colleagues from Argus whom I know already, Jena sir, namaskar, and Sau sir, namaskar. And all the most importantly, I feel patient is the most important stakeholder for any healthcare delivery or any healthcare to be effective. Why? First of all is that a person has to be very much involved about self-care. All the time we discuss about services being provided to a patient, but at the same time, a patient also has to equally participate in his or her health. So my request to or humble submission to all my media fraternity is that how can we make each person aware about their health, also empowered about their health, and at the same time give them that competence or that kind of skills so that they are able to manage their small illnesses, minor illnesses on their own. So when we look at health service delivery pyramid, if you see that 60 to 70% of our minor illnesses can be managed by self-care. Not necessarily for each problem we have to come to the facility. And therein, as told by very nicely Gautam Khanna ji, we require this point-of-care diagnostics. Did any one of us know how to measure our oxygen saturation before COVID? No. COVID pandemic taught us that we can monitor our own oxygen saturation. Did any one of us know what is the city value? I have heard many questions from many people from rural area also asking, what is my city value? My COVID test is positive, what is my city value? That shows the patient empowerment through information, and herein the media played a very, very critical role. I will next, above the self-care, the second most pillar for a robust health service delivery is strengthening primary health care. There cannot be any substitute, any alternative to a strong primary health care, because 90% of our problem and 90% of our problem of 90% of our patient can be tackled at primary health care. So strengthening the primary health care, most importantly now that we are having health and wellness center or Arogya Mandirs, the role is that not only prevent illness, but also promote wellness. So these two, prevention and health promotion, both are equally important and complement each other so that a person doesn't have to move to secondary care or tertiary care. So these two, self-care and primary health care, if they are focused on, I think the footfall or the load on the secondary and tertiary care are going to be reduced, and they can devote their time, their energy to the cases to which they should ideally do. Many a times we see tertiary hospitals are becoming primary healthcare center. They are seeing some routine illnesses for which they should not do, because they can be easily taken care of at a primary healthcare center, which not only reduces the burden on the hospital, but also on the patient. A patient has to move from PSC to a sub-division hospital, from sub-division hospital to a medical college for a problem which could have been easily solved at a PSC. I am just giving you an example of one research study I did, which shows the whole nitty-gritties of a health service delivery. Long back, I did a study with a cancer hospital to find out the time taken between the first appearance of symptom, cancer jo bhi gote symptom, pain hela, ba bhuko helani, ba kuch non-healing ulcer, the first appearance of a symptom and the final diagnosis and treatment initiation. These are the 3 points, critical milestone in cancer care trajectory. So what we found when we interviewed around 343 individuals who were diagnosed with cancer, we found that the median time interval between the appearance of symptom, aji jodi problem hela, tar diagnosis hela, mean time is 263 days. Can you imagine the time taken for the appearance to the diagnosis? While we are saying cancer survival is 5 years, losing 260 days in just diagnosis is something we really have to look at. Of course, it is I'm saying something which is 12 years back. Then after that, being diagnosed and starting the treatment, it took another 111 days. Why? Because they had to arrange their finance, they had to find out some escort who will go and stay there for chemo. But now, these things have been started to be getting solved. We are having daycare chemotherapy for which a patient doesn't have to come and stay. We have delegated the detection of cancer into district hospitals. So what I'm saying is that things are definitely progressing. The way the theme of today's Health Connect is precision, prevention, and progress. We are progressing definitely, and I'm sure with the support of media and with all the citizens who are here, who are committed for making Odisha not only a robust health service provider state, but also as a medical destination for many other states, I'm sure we all together can do it. And so not only so the India, but also to the world that Odisha can do it. I'm sure with all of you. Thank you very much.
Thank you, ma'am. Definitely with right dynamics and equation, every teamwork can become a dream work. Beautiful, beautiful words. Moving ahead, it's a matter of sheer pride and pleasure that we have with us today none other than Commissioner cum Secretary Department of Health and Family Welfare Government of Odisha, Ms. Aswati S. Ladies and gentlemen, she is an economist by education and a career bureaucrat by training and profession. Ma'am's long 21 years of leadership experience in the Indian administrative services has helped her to have considerable expertise in public administration and governance, especially in the field of public health, nutrition, gender, child rights, and education. She is a Master's in Public Policy from the University of Oxford with Order of Merit and third rank holder and topper among women in the country in the National Civil Services. Ma'am, a matter of your pride again. University topper in MPhil degree and stood among the top 5% master students in the country in the NET test. As all of you are aware about the same. College toppers in master's degree, lot many accolades. If I talk about her career and education, as a member of the faculty and master trainer at the Lal Bahadur Shastri National Academy of Administration, she has set so many trends. I would definitely like to mention that in Odisha, she has served in various capacities. Let it be district magistrate of various districts, director of social welfare, secretary, school and mass education, and health and family welfare. Ma'am, we are delighted to have you, and we all are waiting for your kind words. ठीक है, जोरदार करताली सहित मैम को स्वागत करियो.
आदरणीय चीफ गेस्ट मंत्री महोदय श्रीयुक्त पृथ्वीराज हरिचंदन जी, मिस्टर गौतम खन्ना, डॉक्टर संघमित्रापति, मिस्टर जैना, मिस्टर साहू, आपण माने समस्तों को मोर विनम्र नमस्कार. So I'm very, very happy to be here. First of all, let me also thank the organizers for inviting me. In fact, what happens is that in our daily lives, when we are dealing with administrative issues, when all of you in the media are trying to deal with the breaking news, sometimes I think it is important that we get together in a single room. Otherwise, we get caught up in too many smaller events and firefighting that we don't plan ahead. Therefore, I think it is important that we get together in a single room to highlight things that are important for Odisha, important for health in Odisha. Once again, thank you so much for having me here. And when I speak about planning for the future, how long one should plan for Odisha? Should it be 1 year, 2 years? In fact, for a sector like health, where I would echo the sentiments highlighted by Mr. Khanna, that Odisha has made tremendous progress in health sector. However, we still have miles to go. And how do we get there? And what should we do to get there? Recently, आपण माने समस्या सुनिते ओडिशा सरकार गोटे प्लानिंग प्रोसेस आरंभ करछथि विकसित ओडिशा फॉर विकसित भारत, विकसित ओडिशा in 2036 for विकसित भारत in 2047. Yes, we are planning to have a vision for the next 2 decades, Now, if we have to plan for the next 2 decades, and since all of you are here who are experts in your own fields, what are the few things that one should keep in mind when we plan for health sector in Odisha and in 2036 and 2047? What are those key trends that one should have a focus on? Number one is that there is a demographic transition towards aging population. This is happening across the world, not just in our country. It is happening across different states in our country, and it is happening in Odisha. In fact, in Odisha, the proportion of elderly population, which is 60 plus, is expected to grow from 9.3%, which was there in at the time of the last census.
मैडम आलोकपात करले आपण माने समस्ते निश्चित भाव में अप्रिशिएट करेंगे एंड बहुत आम मैम को धन्यवाद देवाक चाहबू कि आज कार्यक्रम में मैम सुचिंतित मतामत रखिले। वर्तमान समय हो जाए एमती जड़े बलिष्ठ व्यक्तित्व को आम डाकिबा पोडियम पाखक शुणा सर मतामत जी निजर व्यस्त बहुल समय किसी समय बाहर कर आज कार्यक्रम में आमर मुख्य अतिथि भाव में आसी पूर्त आईन अबकारी विभाग मंत्री श्रीजुक्त पृथ्वीराज हरिचंदन सर मु कहवाक चाहिए पृथ्वीराज हरिचंदन महोदय प्रयास जो आम कहीपर ओडिशा रे आईन कानून सुधारिबा नया प्रणाली सुदृढ़ करबा एवं सरकारी विधान सृष्टि करिबारे से मुख्य भूमिका निभाइछन्ति। He is a prominent political leader and a senior member of BJP in Odisha. He is currently serving as the Minister of Law, Justice and Legislative Affairs in the Odisha government. Sri Harichandan has been a dedicated public servant and a strong advocate for legal reforms and justice in the state. Born and raised in Odisha, he has been active in the political arena for several decades, earning respect for his leadership, integrity and commitment to the welfare of the people. He has held various important positions in the state government and has been instrumental in shaping legislative policies aimed at the development of the state. As the Minister of Law, Justice and Legislative Affairs, he plays a crucial role in overseeing legal matters, ensuring the fair implementation of laws and contributing to the legislative framework of Odisha. His contributions have been focused on improving access to justice, enhancing legal education, and strengthening the governance structures in the state. Under his leadership, there have been tremendous changes, impactful initiatives which are aimed at improving transparency in governance and strengthening the legal and judicial systems in our state, Odisha. Sri Harichandan's work continues to have a significant impact on both the political and legal landscape of our state, Odisha. With a big round of applause, let's welcome our Chief Guest, Honorable Minister, Law, Works and Excise Government of Odisha, Sri Prithviraj Harichandan, sir.
तृतीय वर्ष अर्गस टीवी जो महान प्रयास ओडिशा हेल्थ कनेक्ट माध्यम निजर नित्य नैतिक काम बाहरी की ओडिशार हेल्थ सर्विस हेल्थ इंफ्रास्ट्रक्चर एक नुआ दिगंत केमिति सृष्टि हम से लक्ष्य से स्वप्न नहीं ओडिशा हेल्थ कनेक्टर जो कार्यक्रम अनुष्ठित होती विशेषकर जो चीफ एडिटर संजय जेना वक्तव्य दूसरे मत लगा केवल ओडिशार हेल्थ सर्विस नहीं संपूर्ण ओडिशा को एक हेल्थ सेक्टर डेस्टिनेशन पॉइंट भाव में प्रतिष्ठित करने जो ब्रेनस्टॉर्मिंग आवश्यकता अच्छी आखि आगे रखिकी वर्ष पर वर्ष 3 वर्ष तृतीय वर्ष से पदार्पण कर प्रयास को जारी रखिए सूचना भी देती भावी निश्चित भाव में भगवान करेंगे से सुफल मिलू एवं भगवान का आशीर्वाद भी अर्गस टीवी उपर सब बेल थाऊ। मंच उपर उपस्थित डिपार्टमेंट ऑफ हेल्थ कमिश्नर सेक्रेटरी मिस अश्वती एस हिंदू हॉस्पिटल सीईओ मिस्टर खन्ना एवं आईसीएमआर डायरेक्टर डॉक्टर संघमित्रापति व्यक्तिगत भाव में डॉक्टर संघमित्रापति पाखे मु कृतज्ञ एवं ऋणी कारण हूँ जिते कोविड इन्फेक्शन होता मु आउ किछि राजनीतिक बंधु आमर प्रमुख काम थिला जो जिल्ला रे हो जो जगह हो जो माने कोविड इन्फेक्शन शिकार हो आरंभ करथिले किछि सिम्पटम्स जणा पड़ुला से मानकर तुरंत तंकर टेस्टिंग करबार प्रक्रिया से टेस्टिंग करबार प्रक्रिया कला परे तांकु कि हॉस्पिटल एडमिट आवश्यकता थिला कि आइसोलेशन रे करबार आवश्यकता थिला से तांकु पुनी डॉक्टर संगे जोड़ीबा ये प्रक्रिया करबा भीतर 5000 ऊर्ध्व पेशेंट को सेते आमे अंतत कोविड हेछि कि जानिबार सुयोग पाइलु से अनेक बार डॉक्टर संघमित्रापति सहित साहाଯ୍य आम नहीं आज आउ जड़े व्यक्ति आम भर ना डॉक्टर अजय परिड़ा स्वर्गत डॉक्टर अजय परिड़ा जी इंस्टीट्यूट ऑफ लाइफ साइंस डायरेक्टर थे भी सामान भाव में से भाव सहायता सहयोग नहीं से दृष्टिकोण से सहायता व्यक्तिगत भाव में आज तारीख में भी डॉक्टर संघमित्रापति कृतज्ञता अर्पण करे। मुख्य उत्पादक भाई संजय जेना श्रीयुक्त प्रकाश साहू एवं एठारे उपस्थित समस्त अतिथि माने एवं कनक्लेव जोग देवाक आसथिबा समस्त डिग्निटरीज माने भाई भौणी माने वास्तव में आज जिते स्वास्थ्य समस्या कथा कहूचे ओडिशा प्रदेश विभिन्न अंचल विशेष करके ग्रामांचल कथा जदि देखा तीनोटी मुख्य रोग आम सामने जो कथा आसूची तीनोटी मुख्य रोग आम समस्त आगे देखा मिलूँ गोटे हूँ हाइपरटेंशन रिलेटेड रोग उच्च रक्तचाप जनित रोग द्वितीयटी हूँ मधुमेह जनित रोग और तृतीयटी हूँ कैंसर प्रायतः ग्रामांचल जो स्वास्थ्य सचेतनता भी कम अच्छी सहर हेले पाखे डाक्तखाना अच्छी आम जाऊे परीक्षा करदे डाक्तर को कंसर सुजोग मिलूँ किंतु प्रायतः ग्रामांचल एवं विशेषकर गरीब परिवार मानक भितर सचेतनतार एक अभाव परिलक्षित होता कारण ये तीनोटी रोग अनेक समय महामारी रूप नौ गाँ गहली रे कहीं ब्लड प्रेशर चेक करती ना जेते कहले भी गोटे निर्दिष्ट बयस पर 40 वर्ष पर 50 वर्ष पर गोटे नियमित इंटरवाल ब्लड प्रेशर चेक कर दिंतु पाखे पीएचसी अच्छी अलग कौन भी हॉस्पिटल अच्छी पारामेडिक स्टाफ किए अच्छा ब्लड प्रेशर चेक कर आवश्यकता अच्छी कहले भी लोक से कथा को शुणती ना एवं विशेष करिकी गत किछि दिन पर कोविड इन्फेक्शन पर जो कथा आज देखा मिलूँ जे अनेक जगार साधारण भाव में गोटे बयस पर हाइपर टेंशन कारण अनेक लोक ब्रेन स्ट्रोक शिकार होगी गाँ गहली घरे पड़ी रही भितर किछि लोक जहाँ सुजोग मिलूँ से आसुच्चंती चिकित्सित होगापाई किछि लोक निज कर्म को आदरिकी भगवान को आश्रारे पड़िकी भी रही कार्डियाक स्ट्रोक जोटा कि गोटे काँ भाँ केतेबेले केमती आगुरी होतला एबे कार्डियाक स्ट्रोक रे मृत्युवरण करुवा लोकंकर संख्या भी गाँ गहली रे धीरे धीरे सरकार संपूर्ण रूपे ग्रहण करने को पूरा प्रस्तुत अच्छा शेष कथा मानक जो हेल्थ डेस्टिनेशन कथा मिस्टर खन्ना किछ पूर्व कहते हेल्थ डेस्टिनेशन ओडिशा पार बेले बेले बॉम्बे हैदराबाद को देखिले हमको ईर्षान्वित लगे बॉम्बे पर आज सेकेंड बेस्ट हेल्थ डेस्टिनेशन अच्छी हैदराबाद बेले देखिले ईर्षान्वित लगे मुझे गोटे छोटिया उदाहरण टे देवी एशियन इंस्टीट्यूट ऑफ गैस्ट्रोलॉजी चेयरमैन डॉक्टर नागेश्वर रेड्डी को पचारि एटी हैदराबाद कौन पे हेल्थ सेक्टर व्हाई नॉट अदर प्लेसेस से कहले द फ्रैंक आंसर इज वी आर सर्वाइविंग बिकॉज ऑफ इंश्योरेंस हेल्थ इंश्योरेंस तो से कारण कोन ताको हम तर्जमा करबा हैदराबाद रो इंडस्ट्रियल ग्रोथ हेची मोस्टली इट इज आईटी बेस्ड इंडस्ट्रीज जो थरी गोटे ह्यूज ह्यूमन कैपिटल रो इन्वॉल्वमेंट रोच एंड एवरीबॉडी इज हैविंग हेल्थ इंश्योरेंस सो हॉस्पिटल रो सस्टेनेंस हॉस्पिटल रो तार फाइनेंशियल प्रोफेशनल ग्रोथ को संपूर्ण रूपे हेल्थ इंश्योरेंस तार सपोर्टिव भूमिका रे ठिया होछि एतै ओडिसा जो सेही दृष्टिकोण जेतेबेले हेल्थ डेस्टिनेशन कथा हम योजना करूचे गोटे प्रमुख कथा होछि जे आमुको गोटे इनक्लूसिव ग्रोथ रो प्लान करिया को पड़िबो एयर कनेक्टिविटी रोड कनेक्टिविटी टू आरंभ करके इंडस्ट्रियल ग्रोथ रो गोटे इनक्लूसिव ग्रोथ पूरा जदि आम योजना करूचे निश्चित भाव में आगामी 5 वर्ष पूर्व ओडिशा को आम एक हेल्थ डेस्टिनेशन भुवनेश्वर एक हेल्थ डेस्टिनेशन ठिया कर एवं ए लक्ष्य को लेकिन आगु को सरकार से अनुजाई तार प्रक्रिया आरंभ कर योजना आरंभ कर आशा करी जो लक्ष्य आज ओडिशार जो स्वप्न अच्छी ओडिशा सर्विस सेक्टर रे भी एक्सेल करू एवं आगामी दिन में गोटे हेल्थ सेक्टर डेस्टिनेशन हो एटा से बाबद रे भी मु भाबुची सफलतार सहित से माइलस्टोन को क्लियर कर परिबा एतरे भूमिका अछि जो माने सरकार रे अछु जो माने प्राइवेट सेक्टर रे काम करचंती हेल्थ सेक्टर रिलेटेड एरिया रे काम करचंती एवं विशेष करके अर्गस टीवी भलिया जो मीडिया जो माने विशेष करके रुचिपूर्ण भाव में एक कथा को लोकों आगे प्रदर्शित करुचंती आम समस्तंकर मिलित उद्यम रे मु भाबुची निश्चित भाव में आम यही लक्ष्य ये स्वप्न आपको साकार करने सफल हवा एवं आगामी दिन में ओडिशा हेल्थ सर्विस सेक्टर रे कहतु किंबा मेडिकल हेल्थ इंफ्रास्ट्रक्चर क्षेत्र में कहतु आम सर्वभारतीय स्तर में 1 नंबर रे पहुँचवा ए आशा विश्वास मोर अच्छी भगवान आशीर्वाद थे निश्चित भाव में आम ए सफल हवा एवं शेष मु जो भाई भौणी दिज गत साइक्लोन समय रे तांकर असीम साहस और धैर्य देखते व्यक्तिगत भाव में मोर अभिनंदन जन मो वक्तव्य शेष करुच्ची वंदे उत्कल जननी जय जगन्नाथ।
बहुत बहुत धन्यवाद सर आपनकर प्रशंसा शब्द आर्गस ये प्रयास पाई आपन को आउ गोटे कथा सर कहवा को चाहिए आपन दृष्टि आकर्षण करने को चाहिए सर हेल्थ कनेक्ट रो सेकंड सीजन रे आमे इक्वली एम्फसाइज करिथिलु इंश्योरेंस पर केमती हेल्थ को आमे कनेक्ट सुंदर कारुकार्य पुनः ए सम्मान सम्मान ढोकन उपढोकन कहि परिबा. We also have the valuable addition and gracious presence of CEO PD Hinduja Hospital and Medical Research, Mumbai, Mr. Gautam Khanna. Can we have another token of appreciation to be presented to Sri Gautam Khanna by our CEO Argus News, Mr. Prakash Sahu. We are thankful to our sponsors, presenting sponsors, Shiksha Anusandhan, associate sponsor, Sanam Sanguineous Solutions Private Limited, Manipal Hospital Bhubaneswar, Aswini Group of Hospital. अनुरोध करिबे अतिथि माननको बसे जिबा पई एवं प्रकाशन को अनुरोध करिबे धन्यवाद अभिभाषण रखिबे.
Thank you, Munmun. You have already done almost most of my job in thanking most of our guests on the dais and off the dais. Thank you, everybody, for everything. That was our purpose. Jyoti pai ame a program 3 ବର୍ଷ ପୂର୍ବରୁ ତ channel ଆରମ୍ଭ ହେଲା ଆପଣ ମାନେ ଯେମିତି ଆଜି ହେଲ୍ଥ କନେକ୍ଟ କନକ୍ଲେଭ କୁ ଆସିଲେ এই ପ୍ରକାର ଆମେ ସମାଜର ଅନ୍ୟାନ୍ୟ ବର୍ଗକୁ ଚଲା ଭଳିଆ ଆଉ ପାଞ୍ଚଟା କ୍ଷେତ୍ରରେ ମଧ୍ୟ ଆମେ ପ୍ରୋଗ୍ରାମ ପ୍ରକାର କରି ଆସିଛୁ. We are basically a news channel, sir. My chief editor rightly said that we do disseminate or deliver news or the happening and whatever mishappening and all, but simultaneously, being a social responsible citizen, we have some duties and we have touched some sensitive areas like health, education, tourism, women empowerment. Like this, we are doing this annual events. The purpose for which we had started the program, and I thank you everybody, our purpose is fulfilled. Prati Varsha, sir, jemti madam au baharu kichi guest mane ashchandi jemti Mr. Khanna, semti resource person mane pratyek session re baharu Odisha baharu semankaro particularly odia lok mane jane bahare achanti semanku ame chesta kar सबो डाकिबा तांकर एक्सपीरियंस अनुभव लोकों पाखे शेयर करवा सब बेले इनफॉरमेशन मिल पारे माने मते तो लगे मु भी एते सब एक्सपोजर पर प्रत्येक सेशन दिन सारा अटेंड कला पर एते गुड़ाए सब इंटरेस्टिंग इनफॉरमेशन थाए लाइक मैडम अश्वती सेड दैट की sensitizing and awareness, everybody has touched the part. That is the main part we are trying to deliver through our platform, and we are doing that, and we are getting very good response, positive response, and we are being motivated, I mean, by the help of all the participants here, particularly the student community and hospitals and corporates, and also, sir, we are sure, I mean, we are trying to involve the startups also. Every year we get some good health startups, and today also we have, particularly this particular year, insurance sector is very much involved with us. Many insurance leaders, corporate leaders, even government and private, they are here with us. We are trying to touch every, I mean, almost all stakeholders in this sector, and with all your support and cooperation, we'll try to do this and take this forward regularly and try to touch our viewers on a regular basis. Thank you very much again on behalf of Argus. Thank
you. We certainly don't want to miss this canon moment, presence of August personalities with us today. गोटे जोरदार करताली पुणी थे आशा करी आमर मानवर अतिथि महोदय मान जो मैंने मंचरे अच्छा एवं यही 3 वर्ष भितर आर्गस चैनल हेल्थ कनेक्ट माध्यम ओडिशार स्वास्थ्य सेवार एक वैप्लविक परिवर्तन आनी जहाद्वारा स्वास्थ्य सेवार गुणमान एवं समूहर उन्नति प्रेरणा जोगे कौन दौड़ा ना पुणी थे हृदय आम समस्त अतिथि मान धन्यवाद देवाक चाहबू. किछि समय विरति पर आमे आरंभ करिया को जाउछु प्रथम पैनल डिस्कशन. टॉपिक टी अछि ओडिशा as a destination next for advanced healthcare.